Can you tell us about yourself, about your art practice, and when you started creating art?
It's in terms of art, I would use the word devotion. And in the last 6 years, I've been interested in post-object art, and in particular Louise Bourgeois, the American artist. And she says that art is a guarantee of sanity, and she also says that art is a privilege. And I see it in those terms myself, but I have a very complex understanding of what art is, and also have ideas about the way art can change perception as well as ideas and be cultural. So it's a fairly complicated thing to kind of get your head around, but you can look at it from many different angles. Very interested in themes of memories of trauma and expressing trauma as a way of coping with trauma, and also ongoing trauma as well as remembered trauma. Is also one of the things I like to do is be as honest as I can about things, and sometimes the things that I express some people find very difficult to deal with, but I have no. For me, in terms of expression, there is no limit on what can be expressed. And
then in this work, you used lots of objects. Can you tell us like what these objects are and where you got it from?
Okay, it's an unusual object. They're what you would call found materials rather than made materials. So it's an assemblage of objects. Some of them are personal, some of them are more symbolic and to do with hospital. Some of them are empty neuroleptic drug dosettes for the drugs that I take for schizophrenia, and some of them are things that you might find in a hospital setting.